I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is Dr. Alicia Thatcher. Welcome, Alicia.
Hi, nice to be here with you. Thank you.
So you're from Canada, right?
Yes.
And tell us what you do there in Canada.
I'm a family physician in Saskatchewan, and I have enhanced skills training in primary care of adults with intellectual and developmental disabilities, or IDD.
So how did you come to be interested in this field?
I started by randomly just applying for a camp counselor job in the summer when I was a high school student. And it was a camp for people of all ages with intellectual and physical disabilities, and I was hooked right away. I just loved it. It was a lot better than scooping ice cream at my other job. And as soon as the summer was over, I knew I had to stay involved with the disability community. I got involved with Special Olympics, Best Buddies, the Next Chapter Book Club, and then as soon as I entered medical school, I recognized that there was such a gap, particularly for the adult community. We have the whole pediatric system. It's quite well established, coordinated, team-based. It's easy to raise money for children's programs, but then people age out of the system and there's just a huge drop-off of services and a huge lack of training. Yeah,
that is something that we see everywhere, really. You know, there are more services available when people are younger, when they're in their childhood, usually with pediatricians, and then when they become adults, things just change, and they don't change, but the system changes, and they don't have access to the same levels of services. They may not have access to clinicians who have an understanding of providing health care for people with intellectual and developmental disabilities, which contributes to some challenges in a lot of ways. Access to health care, health disparities, all of those things. So you kind of have a bit of a mission in this field. So what's some of the work that you're doing to improve that situation?
So locally, I'm the only physician in Saskatchewan who has any extra training in care of adults with IDD, and so big responsibility, but I can't do it alone, and so I need to make myself redundant in order to make it sustainable. And so I'm working on curriculum development, changing undergraduate level medical education, trying to figure out ways that the different health professions and health professional students can collaborate more together. Family medicine residency programs. I've developed a clinical and didactic curriculum for the family medicine residency programs, and we're expanding it to all of the residency programs for family medicine across the province, and I would love to continue to expand that work throughout Canada because it's not standardized. So that will be a big part of it, and what goes naturally with that, in order to have curriculum, you need faculty that are comfortable providing that clinical training as well. And they already have patients with IDD, but what naturally happens is that I'm then in a position where I'm being asked to do faculty development presentations, and people become more and more comfortable and confident and provide better care to their patients with IDD in the process of their goal to becoming more competent so that they can teach the students and residents that they work with. And so it does seem to just have bigger and bigger effects throughout the community. And then nationally, within Canada, we have the Developmental Disability Primary Care Program that is a part of Surrey Place, and the CFPC, which is the College of Family Physicians of Canada, their Developmental Disabilities Member Interest Group, which I'm the vice chair of currently, and we are working on all sorts of things to develop tools and helpful resources that go along with the Canadian Consensus Guidelines for primary care for adults with developmental disabilities, and we're working on disseminating that and getting more input from people with lived experience, the patients themselves, the caregivers, the families, and figuring out how we can just continue to work together towards these same goals.
That's incredible work. I have one really important question. When do you sleep?
I don't. Not enough.
Yeah. So I know, we're coming to you today from the American Academy of Developmental Medicine and Dentistry conference in Denver, and I know you play a role in that organization as well too. Mm-hmm. Tell us about it.
Yeah. So the way that I found out about it was just before I started medical school, or I guess before I was accepted into medical school. I came across an article about the Lee Specialty Clinic, where Dr. Matt Holder and some of the other AADMD board members and founders are a part of. And I read about it, realized that I could combine my passions and that there are places that exist that are providing exceptional care to this population. And so the day that I got accepted into medical school, I sent off an email, said, please let me come and learn from you. So I planned an observership for a couple weeks at the end of my first year of medical school. And then I think the clinic was shutting down because the majority of the staff there were going to the AADMD conference in Chicago. So that was in 2016, and they told me to tag along, which of course I did. And the members, the board, the attendees were just so welcoming, and it was so inspiring, and I knew that I found my people. And I've been a part of it ever since, and I've been on the board for, I think, 3 years now. Don't fact check me, but before that was part of the conference planning and student resident committee, part of the leadership there, and yeah, they've got me hooked. They're never getting rid of me.
It's an incredible organization of clinicians of all types, but mostly physicians and dentists who are really working together to improve the education of clinicians and to grow the capacity to provide equitable health care for everyone, for people with intellectual and developmental disabilities specifically. And it's pretty neat because, it's dentists and medical health care providers that working together. And there's so many things that are so interrelated in providing health care to people with disabilities, really interrelated for everyone, frankly. Our mouth, our teeth can cause other issues in our bodies and vice versa. And that integrated approach I think is really important as we move forward. How does that look in Canada? Or is there an integration between medical and, say, behavioral health or dental care?
Not enough. Again, in the dental world, there's a lot more collaboration, but in the adult world, it's a huge gap, especially medical and dental. And I didn't think it would take this long, and I guess to still not see any collaboration. Not that it sounded like I was saying there's finally something, but there isn't. But it is a big goal of mine, and I want to use my the relationships that I've built with AADMD to figure out how to build that in Canada. I think it's really important, and it's part of what my teaching is. Whenever I'm teaching students and residents, I always say, one of my first questions always is, when's the last time they saw their dentist? Did you look in their mouth? Is there dental pain?
And that's not something physicians often think about.
Exactly. So I have to teach it. Yeah. So it's a start, but we definitely need to collaborate more. There's so much that we can learn, and I'm sure a lot that we can teach our dental colleagues as well. Sometimes I think there was a presentation at the conference here that was talking about how there's lots of people who only go to their doctor or only go to their dentist, and there's some that do see both, but there's a huge population that is only seeing their dentist, and so they need to know some of the stuff to look for.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things I like to do on the show is ask guests to tell us 3 things in 3 minutes that you think can help improve the world for people with intellectual and developmental disabilities. Mm-hmm. Ready?
I'm ready.
Go.
Okay. All right. The first thing that I would say that's always really important, any advocacy efforts that you're working on, remember nothing about us without us. So make sure that you are including the people who have the lived experience, because we can't speak on their behalf. We need to use our platforms to amplify their voices and make sure that we are getting them involved right from the beginning, seeing what it is that's needed, bringing them in as teachers, paying them appropriately to not just share their lived experience as a volunteer, because that's not fair, but really including them. It always makes the education more impactful, gets people to remember. It helps to challenge the stereotypes and just show the diversity and the strengths of the individuals that are affected by the work that we're doing.
Well said.
Thank you. Number 2 would be, remember to use language or think of language as a tool for advocacy as well. So what I often teach students and residents is that the words they're choosing in their dictations and discharge summaries and clinic visit notes will greatly impact the biases and assumptions that people have who are then reading those notes. And so if you're going to say this person suffers from Down syndrome, for example, or this unfortunate person, it completely changes your view of this person's quality of life and what they deserve, or it might change what management options the person is thinking of even offering. If you think that prolonging a person's life that is suffering, it just doesn't make sense. But if someone has had Down syndrome or autism or any specific or any kind of intellectual or developmental disability, chances are they've had that their whole life, and it's not something that they are directly suffering from. They're probably suffering from this, our healthcare system and discrimination and stigma.
You're right.
But it's not that. If the person has an ear infection, yeah, they're probably suffering from that, but they're not suffering because they have this syndrome.
Excellent point.
Thank you.
You have a third?
I do have a third.
All right.
And my third would be to find every opportunity to advocate for a curriculum. So as a medical or dental student, as you're going through, you will see gaps. For me, in my first year of medical school, there was a community, kind of a community placement, different options. Similar in second year, a focus on social determinants of health and partnering with, a specific community organization on a list. And I went to the faculty and said, disability is not included in here, and there are all sorts of organizations that I can connect you with. And so we found ways to get it into the existing curriculum. And no, not every single student would get the opportunity, but at least it's there. And so it would be great if everyone could completely reform the curriculum and make it inclusive, and if it wasn't so hard, that would be great. But that's not the world that we live in. There's going to be challenges, and there's going to be unique differences between different colleges and communities, and that's okay. And there's different strengths and different kind of rules and limitations, and we need to work within that, but just be creative, find the opportunities. If you have a chance to give a talk about something, see if you can make it about an IDD topic, something you're passionate about, and give your colleagues and peers the opportunity to learn from you while you're there.
To move things forward, you often need a champion. And you're certainly a champion in Canada for this cause, and really all over. And the impact that you're having, while it may be not as quick as you would like it is certainly having an impact and moving things in the right direction. Keep on doing what you're doing.
Thank you.
Alicia, thank you so much for taking the time to talk with me today, and so much more for the work that you do in this field.
Oh, thank you very much for having me and for having this podcast.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.